Hi, this is Dr. Paul, and thanks for tuning in to yet another video from Waterfront Dentistry by Paul's. Today I'd like to talk to you about the treatment modality out there called a bridge. Now, to answer what a bridge is, I have to first tell you what crowns are. When you have a tooth that's compromised structurally from either deep decay, large fillings, or even some kind of fractures or trauma, you need to give this tooth a crown or a helmet. It's basically an armor that sits around this fragile tooth circumferentially and protects the tooth from a 360-degree point of view. To do this, you got to file this tooth down from all sides and then put a cap or a helmet around this tooth and then cement it. So this is what a crown is. Now, when you have a tooth missing from, again, decay, fracture, infection, gum and bone loss, you will have a space between a tooth in front and the tooth behind. In a situation like this, you might be a candidate for a bridge. So a bridge is when the tooth in front of the space and the tooth behind the space is shaved down and prepared for crowns, and then these crowns are soldered or splinted to a fake crown or crowns in the middle, replacing a missing space or spaces, and all of them are cemented by using the teeth that are on either side of the missing spaces. So now let's break it down to technical terms. When you have a bridge and you're looking at the prosthesis of a bridge, the part of the crown that's resting on a tooth is called an abutment, and the part of the bridge, which is the crown that's not really sitting on anything, is called a pontic, and the part of the crown, again, which is resting or sitting on a tooth, is called an abutment. So a bridge is basically a combination of one or two or three abutments on either sides and one or two or three amount of pontics in the middle. So hopefully this isn't too confusing. If you have any questions, you can always shoot us an email, drop in a line, and we can definitely try to answer this question. Now, what are the advantages of a bridge? A bridge is less expensive than an implant. A bridge, if done right, can last you a long time because it's splinting the teeth on either ends of an edentulous space. Hence, these teeth will not collapse into the gap in the middle. And also, like the saying goes, there's strength in numbers. The amount of bone around these teeth will still stay the same because it's all splinted. The third advantage, of course, is you're getting a fake tooth in between, which is not really a tooth, but it's also mimicking a tooth, which means to say that if you're smiling, if you're laughing, no one will really see a gap. What are the disadvantages of a bridge? A bridge, because it's a splinted unit, is very difficult for you to keep clean. And by that, what I mean is you can't really floss between the units of a bridge because all these areas are soldered. Other aids that you can use to keep a bridge clean, yes, there's something called super floss, which is a floss that has a stiff end, a fluffy end, and a regular end. It's really easy to use, and like I said, if you have doubts about this, please shoot us an email and we can definitely answer that question. The other disadvantage of a bridge is if you ever end up having a cavity under any of the surfaces around the abutment, unfortunately, we can't really patch things up or fix things up superficially. Most of the times, rather than not, we will have to take the entire bridge out, patch things up with decay, take the decay away, and then put a new bridge on. So what this means is even a small cavity around a bridge can end up being an expensive proposition just because the entire structure needs to be taken out and a brand new bridge has to be put back in. So this is one of the disadvantages of a bridge. For the most part of it, if you are someone who regularly comes in for cleanings, brushes, flosses, uses a high fluoride toothpastes, and do a lot of things at home like using water picks and commonsensical aids like this, you really don't need to ever lose a bridge. In fact, I've known people who have had bridges on for 25-30 years and it's still in their mouth because they were done well and they've been maintained well as well. So these are the advantages and disadvantages of a bridge. Again, I hope this video has shed some light into the fact that this is a treatment modality which is highly practical, could be highly aesthetic, and is one of those things that can be in your mouth for a long time provided the hardware is taken care of regularly. If you have any questions, comments, suggestions, if you are doubtful if you're a candidate for either a bridge or an implant, send us an email. If you want to make an appointment, you can absolutely come in and have a word with us, and we can take it from there. Thank you for watching.